Hi, my name is Brittany Watson, and I will be discussing with you electronic health record. The health information profession is being transformed from paper environment to a virtual electronic world. Health information professionals have unique patient information management skills that will assist facilities in making the transition to electronic health record. And in order for HIM professionals to understanding the computer terminology necessary. Now, HIM stands for Health Information Management. Understanding the computer terms is needed to understanding the complex electronic health record system in use today. Think of hardware as parts of the system that you can touch, and such as hardware used is central processing, input-output devices, storage devices, network equipment, and so on. And central processing unit, which is known as CPU, controls the processing of information throughout the computer system, includes the control unit, arithmetic, and logic unit of a primary storage unit. Besides hardware, computers also need software programs that are used to operate the computer and perform functions. And there are two types of software, which are operating software, which consists of a set of computer programs that controls the hardware. There is also the application software, consisting of computer programs that allow the user to perform a particular task or function. Advances in hardware and software development have profound impact the manner in which the healthcare industry incorporates technology. From the 1960s to the present, many terms have been used to describe automated medical record system, and throughout the 1980s the development of automated systems was slow, but the vision of electronic record systems was a good of the healthcare industry. The IOM concluded that this could be accomplished through a computer patient record, which is also known as a CPR, which is a multidisciplinary and multi-enterprise software that has the ability to link patient information at different locations according to a unique patient identification number. Then you have the advantages of the manual, which is like the paper-based, which is the low startup cost. They're available because there is no downtime. But the disadvantages is retrieval of the information is not easily customized, and handwritten info can be illegible, difficult to obstruct info, such as messy handwriting, or you just can't read the handwriting, period. And then you have the automated advantages with like electronic based record, which is improves access to patient information. Multiple users can access that information instead of just one at a time. And then you have the disadvantages, which is the increased startup cost. The staff training is time consuming and can be expensive. And then you also need a technical staff that needs to be maintain the system. And then electronic medical record, which is a protected health information that is in electronic form. And you have a health level 7, which is standards development organization that develops electronic health record EHR standards under the orientation of the U.S. Department of Health and Human Services. Personal health record, electronic or paper medical record maintained and updated by an individual for his or her own personal use. And then there is no two facilities that have the same electronic health record system in transition from paper to electronic health records. Facilities transitioning in electronic health records in various stages. The issues impacting the electronic legal health record facilities need to clearly define their legal record to be able to respond to various requests for a patient's entire record. Legal record must be defined in facility policy and standards for maintaining the security and important of the record to be clearly defined. With an increased number of healthcare facilities developing electronic health record systems. The networking of electronic informed between facilities has become a reality by establishment of the RHIO, which is also known as Regional Health Information Organization, which is an electronic network and medical information about patients, which was gathered from multiple health care organizations in a geographic region. And the first step in establishing of the RHIO is for a group of stakeholders to come together and establish the need for the RHIO and to articulate the vision, which is there are numerous electronic health record systems used in facility as stated before. The goal is still the same: to collect, analyze, process, display, to retrieve healthcare data, and so on. After data has been collected and is given a meaning and is useful in the decision making, data becomes the information. Health information is defined as the data that has been given meaning and has been processed, organized in a manner that is useful. There are two major components of electronic health record system. You have the administrative application and then you have the clinical application. One basic function found in all systems is the collection of patient demographic and insurance info. And you have registration, admission, discharge, transfer system, which is also known as RADT. Is a database of patient demographic information that is used during processing of inpatient and admissions of discharge. There are various clinical applications such as patient monitoring system, pharmacy applications, laboratory applications, radiology, you have nursing application, medical documentation application. You also have patient access application. Now, there is an impact of the American Recovery and the Reinvestment Act, which that was signed into the law on February 17th of 2009, and the impact of this act on health information technology will be a major force in moving the U.S. healthcare system into the electronic environment. Then you have the HITECH, which is HITECH, which is Health Information Technology for Economic and Clinical Health Act. It provides incentive through the Medicare and Medicaid EHR incentive program. And then you have the areas that the act will further impact, which include the investment of health information exchange, the new privacy regulations for both HIPAA and non-HIPAA entities. And you have the HIM workforce opportunities that will expand the opportunities of professionals. And you have as more facilities use electronic health records system, the world of health information management is changing. The data used within facilities and is also shared via health information exchanges. From data to useful to data has to be managed. And you have the governance that has become a critical function of the healthcare industry, uses ever more data and info to make clinical decisions. So, all in all, transitioning records from paper format to electronic format presents the healthcare industry with many development and implementation issues. The exchange will continue to enhance by the development of regional health information organizations and other federal entities. That is my speech. Thank you. Hope you like it.